So if you're ever worried about going to the doctor and getting overcharged for medical care or being discriminated against because of a health condition, Katja Morgan was one of those HHS specialists there to provide oversight and accountability over insurance companies. Workers like Katja at the Centers for Medicare and Medicaid Services make sure that regulations are in place so patients get all their benefits covered and that they are charged and treated fairly. But now the Trump administration, along with its slasher-in-chief Elon Musk, are taking a chainsaw to our government and our federal workers. Workers like Katja, who was among those that lost her job, now reeling over the loss of not only that as a health insurance specialist at the Centers for Medicare and Medicaid Services, but, she's worried about her livelihood along with what this means for the future of health care.
There is a lot of sadness in my heart. There's also a lot of anger. The firing of thousands of federal employees across the government is going to have detrimental impacts on regular people like yourself watching this video. The only purpose of all of this is not to decrease the federal deficit or decrease spending like they're claiming. We make up such a small portion of federal government spending. It's really to decrease regulation and allow businesses to go unregulated.
Katja Morgan joins me now. So first of all, this is how we found you. It's employees like you that are going out there, making videos, putting out on all the platform so we can get a personal look at how these cuts are impacting not only your livelihood, but what your job actually did. I mean, the irony of the whole thing is these cuts are to cut out waste and corruption, yet your job was to cut out abuse and corruption.
That's exactly right. I think it's very ironic, when people hear about federal workers, I think for so many people across the country that can sound really abstract. People don't understand the work that we're doing within these agencies. So really my point with the video was to try to tell that story and explain what people like me are doing for people all across the country who never know that we exist or that we're working behind the scenes. But there are thousands and thousands of people in the government that are doing that work, trying to make healthcare better for everyone.
And Elon Musk puts out this email, tell me the 5 things you did in the last week. Just put into perspective what you've been doing in your job to rid abuse. I mean, we all know what we go up against with insurance companies.
No, that's absolutely right. So when health insurance companies want to sell their product, their health plan on the market, they have to come to CMS, the agency that I worked for first, to get approval and make sure that they're following the law. So we are reviewing all of the terms and conditions of their contracts. We're looking at every single benefit that they cover, how much they're charging for that benefit, and we're making sure that they're following the law. That's the key job that we're there to do. And so every time that you lose a federal worker like myself, you're losing another body that is dedicated to doing that type of work.
So without you, what falls through the cracks? How does the average American suffer?
Well, there are 24 million people who get their health insurance coverage from the marketplace, which went into effect after the Affordable Care Act. And so there are millions of people potentially that are buying health plans from the health insurance marketplace that are going to have maybe less oversight of their plans. There are fewer people around that are doing those checks to make sure that they're covering the benefits that they need to. I think another portion that I talked about in my video is that part of this is non-discrimination as well. There are non-discrimination laws that make sure that, whatever your health condition is, if you get sick, your insurance company can't discriminate against you anymore. They can't charge you more for a specific service just because you were sick. And none of that existed before the Affordable Care Act. So I think it is easy for people to forget, what health insurance looked like before, 2009, 2010. And I really worry that we're getting back to a place in time where people are struggling to afford their medical bills, and health insurance companies are able to take advantage of that without people like me around doing that work and making sure that they're following the rules.
Your message to Elon Musk? Keep it clean.
Yeah. I think people go into public service because they want to make a difference. There are a couple thousand of us in the entire country who are managing the healthcare for hundreds of millions of people in the country. And we are taking, lower paying jobs because we are passionate about the work. We could definitely go to the private sector and make more money. That has never been the question. It's that we are here because we want to make a difference. And I just find it very ironic that the richest man in the world is talking about government efficiency. But, if they increased the taxes on Elon Musk, they could make up way more money than they're saving by laying off all of these federal workers. I just find it very ironic.
I know you're going to figure out something. I just have a feeling, and I want you to keep us updated. Katja Morgan, thank you very much.
Absolutely, and thank you for telling these stories. I think it's so important to get the message out there that this is affecting so many people's lives.
We're trying to do it every day, and people like you help us make it happen. Thanks, Katja.
Thank you so much.